on 90.3 FM. It's Wednesday, Joe Steckler Day, helping seniors of Brevard. Joe is off today, recuperating from his knee surgery, but in his place, you've got me, John Harper, and of course, Kerry Fink. Kerry, you've got some special guests with us today.
Of course we do. I am so excited that we have sitting here in the studio with us. We have Jennifer Helin of Seniors Helping Seniors. Hello, Jennifer. How are you?
Good, Kerry. How are you today?
All is good. And also sitting in the studio with us is none other than the world-famous, world-renowned Dr. Kevin Kilday of the Holistic Health Center. How are you, sir?
I'm very good. Thank you. Glad to be here.
You know, and I was just pulling up a copy I get because we are part of Helping Seniors. We actually get to read the Helping Seniors newsletter for November before the general public does. Mm-hmm. You know, the newsletter comes out in the center section of Senior Scene magazine. And what a happy coincidence. Just as you guys are seated here, you guys are side by side on the same page in the November newsletter.
Oh, wow.
How about that? We are.
And Jennifer,
very good. We're in good company.
Jennifer, you have your topic for November is family caregivers at holiday time. And then for Dr. Kevin, he has the air you breathe affects COVID or not. And actually, that might be an interesting place to jump in because you guys were actually having this conversation just before the mic opened up. We just did a Helping Seniors update. I did with Dr. Kevin Kilday of Holistic Health Center. And we were talking about this, you know, when we're all worried about the airborne effects of COVID and other things, this seems to be something that you've looked into. And tell us a little bit about it, Dr. Kevin.
Well, yes. There is a new product. Well, it's not new. It's new technology, actually. And there was a public announcement on September 30th of this year, 2020, that this particular air purifier was scientifically proven in an FDA-compliant lab using live COVID-19 strains of the virus. And it showed that it killed the COVID-19 on all surfaces 99.98%.
That's amazing.
That is pretty amazing. And the part, because I'm a big space buff and I'd like to be an astronaut when I grow up, it was evolved from early stage NASA designs. And you were telling me, Dr. Kevin, this isn't like some fly-by-night company that just popped out of the woodwork. These people have been doing this for many years.
Yes, this particular company has been in business for 95 years. They're one of only 75 companies that are in the space Hall of Fame because I believe they assisted NASA with some air purification systems on some flights in space, and it's just a great product for with this pandemic we have going on, and it helps anybody who it really just helps everybody, but particularly people who are at high risk that may be at home and have some respiratory problems, asthma, COPD, allergies, etc., lung disease, and this would help a great deal, not only purifying their air, but make them rest assured that in the rooms that they live in are that there's no COVID-19 on the surfaces.
It's pretty amazing when you think about it, because they told us, if you remember the history of this whole thing, when they first were telling us about COVID, they said, nah, don't bother with face masks, right? And I don't know if that was partially because they needed just to save them for the frontline workers or what it was. And now, of course, the good common sense advice is, here we are. We're all sitting in the radio studio today. We have our masks on, and they talk to us about social distancing. They talk to us about washing our hands and all these things. But one of those things that it doesn't seem like you can get a straight answer on is how far this stuff gets transmitted by air, right? So you remember early on, it was like set your groceries outside for 2 days so that the COVID doesn't live on it and things like this. And what I think, if I'm following what you're saying, Dr. Kevin, correctly, is that when you have this kind of technology, it's making sure it's pulling it out of the atmosphere so it's no longer a threat.
Exactly. And it's not only for COVID-19 virus, but It also has killed other viruses and mold and fungi, bacteria. So, and there's no odor whatsoever with this product. It's just a matter of what I say. Just park it and plug it in. You can live and work around it. It's not a problem doing that either. And that the specs I gave you before was 99.98. After 7 hours. However, 94% after 3 hours.
Wow, it's pretty fast
quick.
working, I would think. So let's rewind just a little bit and zoom back out to the big picture. We're almost here at the 1st of November, and actually nobody's paying attention to the 1st of November. Everybody's paying attention to the 3rd of November. And so our number one piece of advice is get out and vote, or you don't have a right to complain about what happens afterwards, right?
Exactly.
So that's number one. But number two, it seems like it was about this time, 7 months ago, that they first started really talking to us about COVID and 30 days to stop the spread. And here we are. We had to do our Helping Seniors car raffle with no audience in the American. We couldn't even go into the American Muscle Car Museum. We were outside for precautions of COVID and all that. And so we're still going to be looking forward to getting some makeup dates where make sure you hold on to those Helping Seniors car raffle tickets, because that will be your admit one into a great event into the American Muscle Car Museum. We're thinking that may be like February, but we'll have to see what COVID decides to do. And in any case, we're hoping that's also going to be the kickoff for the 2021 Helping Seniors car raffle. And Jennifer, you participated directly in the Dodge versus Chevy challenge.
Which was a lot of fun.
It was. And I was thinking, what's going to be cool is the 2019 winner chose the Dodge Challenger, which was the team that you were on. You were Team Dodge, right?
Yes, that was a beautiful car she got. Yes.
And then our winner for 2020 chose the Chevrolet Camaro.
How about that?
So now it's all tied up, one apiece. and we're going to need to invite, when we do the filming for the Dodge versus Chevy Challenge for 2021, we'll have to invite both winners out with their cars and have them be like honorary members of Team Dodge and Team Chevy or something.
I think that would be great. And I would love to drive the Camaro that they did get, because they got the Camaro and they did do an upgrade. So they got the convertible. Yeah.
I was telling Dr. Kevin when we were out there, and John Harper, you too, because when you guys were doing that interview on the Saturday Grand Raffle Day, we were all standing in front of this beautiful red Camaro, and that is the very car that the winner chose.
I was checking that one out myself, Kerry, and I know several of us were leaning against that car, making sure that we could perhaps walk away with it, but no such doing there in the showroom at the Chevy dealership, Bonnevay Sires. But nonetheless, a beautiful car. By the way, there was another nice car in the showroom. Did you see it on the entire other side? It was like a 1957 Chevy Impala.
Oh, that was a beautiful car. That was a beautiful car.
Did you see
yes,
it?
I do remember seeing that one.
Yeah, that was nice. That was in pristine condition.
AJ Hires has an amazing collection himself. I guess it's pretty neat when you're a car guy and you know how to find the right cars and get them all squared away. It's good. But anyway, thank you to everyone who helped us in the Helping Seniors car raffle. Such an important way to keep the work of helping seniors going. But the reason I kind of wound up into this was because I thought for today we might use the technology. What has technology brought to us in the COVID world? And I was thinking, even as we started the show, and we're talking about Dr. Kevin Kilday, and one of his latest things that he's working with on the holistic health front is a high-tech air purifier, because they tell us, right, if you have an underlying condition, especially you want to be careful, and seniors by default fall into that high-risk category. So taking a look at technology like that could be useful. But then, Jennifer Helin, we've been talking all through this time, while you have been able to get out safely to folks' homes and help them with some things, obviously a lot of your routines for the helpers that you have shifted around a lot, and you've had to start to use a lot of technology to help manage all this too.
Yes, things have definitely changed, and we've changed along with it. And one of the things that happened along the way is we've gotten more and more calls for telephone check-ins. we had calls for that prior to COVID, but I never really wrapped my head around it. But COVID, unfortunately, made me stop and think, how could we do this and do it in a way where it's really serving people and getting accomplished what needs to happen? And so we did a little research. We talked to our home office. We talked to some medical professionals, and we're really pleased with the end product. We're offering now TeleCare services, telesupport. And it is, we still go and do the assessments, but it's a very personalized over-the-phone check-in, so that our folks who are still really hesitant to have someone out in the house, we can call and we can go. It's a very personal, very cordial, compassionate phone call. A lot of companionship involved in it as well. But it goes through a medication reminder. It may be a blood pressure check reminder, check in on the weight. What is the weight today? What did we have for breakfast? What did we have for lunch? Depending on the conversation or time of day and the assessment, it goes through a checklist of things that we can then make sure that we are reporting on to the family if needed, and assess how that person is doing, provide some socialization and companionship, albeit over the phone. And we've got a lot of customers who are really interested in this new product because it's something that's never been done here, to my knowledge, in Brevard County. And like I said, they're still hesitant to have people out, but yet they know they need a little bit more than what they're getting right now because people have been so isolated.
Jennifer, I'm sorry, Kerry. Jennifer, do you feel confident after the teleconference that you and your staff are getting the types of information they need to assess the patient and making sure that they're in good shape?
Yes, and we're running the program, even though Seniors Helping Seniors is non-medical, we don't do any of the hands-on services. A lot of our caregivers, our providers, as we call them, are retired RNs, LPNs. We've got several retired physical therapists. So we're using those folks with that medical background, and they have that medical ear. We're using them to make those phone calls so that they can be a little bit more educated in those conversations. So because of that, I'm very comfortable that we are able to provide that service and hopefully identify any problems before they arise. And obviously, these are folks who are still very independent, living in their own home and not maybe medically needy, but still need that check-in and a little bit extra care.
And I was thinking about this because we've had this conversation. I've been amazed as we've gone through this entire time that both when I talk to people who are connected to helping seniors who are involved in senior care, maybe I would call it in a like in an assisted living or places like that where they're literally living with the seniors, as it were. And then when I talk to everybody who provides services in seniors' homes, it seems pretty universal that everybody has been able to keep seniors safe just by being very cautious and very careful about all the correct procedures to do that. What has not been as easy a challenge to overcome, as I gather, and I remember Dr. Kevin Kilday, you did actually a article about this recently, and I know Jennifer Helin, we've talked a little bit about this before on radio and things as well, that one of the challenges for seniors in this isolation world is just that, of isolation. And we've talked about this before. You can't have necessarily families who might have traveled down from up north over the summer to check on mom or dad, or maybe even worse during this holiday season where they're saying, be careful at turkey time and things like that. So this technology has really become a must, hasn't it, Jennifer?
It really has. We've really had to think outside the box in a way to serve people, but serve people safely. And knock on wood, we at Seniors Helping Seniors have been COVID-free this whole time and plan to keep it that way. So even though, we are still going into houses, we've been able to keep people safe, but there are still people who aren't comfortable having someone in the house. So yes, you do have to think outside the box, and the technology helps us do that.
And I was thinking about this, even Dr. Kevin, you have adjusted how you are able to meet with patients face-to-face at your offices over at the 1900 building in downtown Melbourne, but you found increasingly that you've been talking to people via Zoom like the rest of us.
Yes, I have added that technology to my practice. Because a lot of people are still afraid to go out in public and to appointments and stuff. So, but even if they do meet me in the 1900 building, which I also use another facility up in Merritt Island. The rooms are thoroughly cleaned at all times. I ask clients to wear a mask, as well as I wear a mask also, and they're always sitting at least 6 feet away from me.
Yeah,
During the consultation. But then on the other hand, if the other alternative is via Zoom, you can do it that way also.
Yeah, so this whole concept of telehealth has become a big thing. I know a lot of times, even if you're calling your medical doctor, they're going to want to see you via basically a modified Zoom call or something like that. But that's really the idea behind what you guys are doing at Seniors Helping Seniors as well. You're trying to make sure that nothing falls through the cracks if nobody's able to show up at the person's house.
Right, and that isolation piece is huge. We are seeing so many people, they've been kept safe from COVID, but they're losing weight, they're having other issues because of that social that's terrible.
Right.
Isolation. There we go. Got it. Depression, anxiety, weight loss. And we're seeing a lot of, unfortunately, people pass that were totally not expected. And it was not from COVID, but it was due to the isolation and a downward spiral. So we want to make sure that even if somebody doesn't feel comfortable having somebody in the house, they do have some type of outlet to talk to someone. And unfortunately, with kids, when parents talk to their kids, they will always tell you, "Oh, I'm fine.
Yeah, sure.
I'm good." And my parents do the same thing, and I do the same thing to my kids. We don't want to worry them, so I'm fine. We're good. It's all good. But when they talk to a third party, sometimes that truth comes out where maybe we're not fine, and maybe there are some issues that we need to talk about, and maybe the blood pressure is up a little bit, and it's something that we need to address right away. So that's the beauty in having these telecalls. We're still keeping them safe. We're hopefully, they're becoming a little bit more comfortable with an outside person, but it helps that isolation piece.
Yeah, and to add to that, it is good for family, out of state to do their own checkup on their elderly family members. I mean, just like AT&T's slogan back in the day, "Reach out and touch someone." That means just give them a call. I mean, they may have some FaceTime technology on their phone, and maybe you can get them to do that. That helps also, especially as she said that mentally it's really affecting. This COVID is really affecting a lot of people. I mean, depression is sky high, not only amongst the elderly, but amongst everybody. I mean, depression rates are sky high, anxiety rates are sky high, drug abuse is sky high, alcoholism is sky high. All these things have risen up because, the root cause could be isolation.
That's why I've often heard it said that, we have to be careful that in the process of keeping everybody medically safe, that we're not actually taking away the reason for wanting to be medically safe, which is to enjoy your life. And Jennifer, you raised an interesting point. It is true when you call mom or dad from out of state or even in state, you're right. They don't want to be a burden, so everything's fine. But I can tell you when we get the calls at the Helping Seniors information line, and Kim Bernard takes those calls, it's almost like, and I'm sure you guys both, in terms of doing assessments, find the same thing. It's almost like a dam burst. They call up, there's one thing, "Oh, well, this is what I'm trying to fix." And then as Kim starts talking to them, we find out there's like all these things that all kind of come rushing out at the same time. Mm-hmm. And I think these are the things that you guys are talking about from the standpoint that we're able to do some things that will make a difference for folks. It's like the next best thing to being there is this. And I was thinking, Jennifer, in particular, one of the things that's cool about the telemedicine is you're high tech, but in a low tech way, because everybody knows how to answer a phone, right? You don't have to try to figure out which app on your phone and all those kind of things.
Right. And we talked about that. We went back and forth of whether we should do tablets and try to do Zoom, if we should do, and we just kept going back to keep it simple.
Right.
And so the telephone was the best way to keep it simple. I think maybe the next generation, the tablets will be the thing. But for this generation, let's just keep it simple and make sure we're reaching out and being able to touch people, even though we're not physically, we are able to talk to people and keep them engaged. And one thing I want to go back to Dr. Kevin's point. Yeah, we still want the family to call. Absolutely. Call, touch base. And one of the things I mentioned in November's article actually is we might not be able to get together for Thanksgiving. We've been having that discussion in my own family of what are we going to do and how this is going to look this year, unfortunately. And, my aunt is 99 and
Wow.
she is not going to be able to participate in the big family Thanksgiving this year. They're going to keep her safe. So what can we do to make that family member still feel included and loved and appreciated? So one of my ideas in the article is to let's bombard her with thanks. Let's everybody, it doesn't matter where you live. You can send a card, a postcard, a little care package.
That's it. Amen.
We can do a lot to make people feel that they are loved, even though we might not be able to physically get together. Let's make sure that our seniors are recognized during the
Does
holidays.
she live here locally?
Yes.
What about somebody in your family going to her house and setting up a cell phone to have a virtual Thanksgiving dinner?
So my cousins will be with her, and they'll, of course, be doing the Thanksgiving dinner, smaller version at their house with her. But yes, we'll be hopefully. My aunt has macular degeneration, so the screens are kind of hard for her to see, unfortunately, but she still loves getting cards. She might not be able to see the picture on the front, but my cousins will read the card to her, and she loves getting that. So we're going to be bombarding her with lots of cards and attention that way.
One of the things I love about the ingenuity of American folks is that you throw us something that we've never dealt with before, and we're going to start figuring out ways to make it work in spite of that. And that's very cool about what you're describing, just about what's going on in your family for Thanksgiving. We're going to be back on the other side of the break. We're going to continue with our topic about how we can use technology to help us overcome the challenges of COVID-19. So on behalf of Joe Steckler, our founder and president, and Kim Bernard, our team, and Jennifer and Kevin and John, we'll be right back.
12:33 in the afternoon here on 90.3 FM. You're listening to Helping Seniors of Brevard, heard every Wednesday, 12 noon to 1 o'clock, right here on 90.3 FM. John Harper with you, and right now, here's Kerry Fink. Hi, Kerry.
Hello, John Harper. Hope your day is going well, listener, and thanks for joining us for Helping Seniors Radio on behalf of our president and founder, Joe Steckler, and Kim Bernard, who's busy manning or womaning or personing or whatever the correct way to say it is, the Helping Seniors information line. The main point is she's helping folks at 321-473-7770.
I sent a person over to her this morning, actually.
Wow. All right,
did.
Jennifer Helin, tell us, that's the thing. That's how everybody works together to help make sure seniors get the positive help that's going to help them along the way for whatever it is that they're facing.
So I had a professional guardian call me this morning, and we had a very nice conversation, but he had just gotten a new person, kind of an emergency situation, and needs help right now with certain aspects of this person's care. So recommended he call Kim, because Kim has been, especially right now, been really keeping a great list of who is doing what, who is able to provide what type of service, especially during COVID. So things have changed. So what is the waiting list? Who is able to provide housing, food, monetary help, anything that a senior might need. She's really kept a great list. And so I said, make sure you call Kim, talk things over with her, and she might be able to provide some additional resources that could be very helpful right in the here and now.
You know, it's so important because as Joe, our founder and president, has often talked about, he says, you know, you got to have an aging plan. You know, we live in Florida, so we understand when they say you got to have a hurricane plan. What are you going to do? You're going to get your batteries. You're going to stock up on water. You're going to have an evacuation plan, depending on where you live. You're going to have a batten down the hatches plan. Whatever, you're going to try to be prepared for a storm coming at you. And the same thing happens with aging. You got to have some help or some way, or at the very least, somebody to call and say, well, how do I navigate this? This is what's going on. Where do I start? Because the other point of this is, I always like to say, aging is on the job training. A lot of it we just don't know till we get there. And it sure is helpful to get a hold of somebody that kind of knows, has maybe, traveled this road before. And that's why one of the things that we were talking about in the first half of the show with our guest, Jennifer Helin of Seniors Helping Seniors. Welcome back.
Thank you.
And Dr. Kevin Kilday of the Holistic Health Centers. Welcome back.
Thank you.
But we were talking about how technology, how we've adjusted to make use of technology in the middle of a COVID time to make things work a little better. And we were, the first half of the show, we spent some time talking about what you guys call TeleCare, which is a new service from Seniors Helping Seniors. And real quick, recap that again, because this is how you get creative in a complex time.
So TeleCare is a service that could be, as needed, or it could be 3 times a week, 5 times a week, 7 days a week, and be a very personalized check-in call, provide a lot of socialization and companionship during that phone call, but also a very individual checkpoint call, making sure that people are taking their medications, they're checking their vitals if needed, that they are eating. It's a kind of a 10-point checklist that we go down through with them to make sure that they are staying independent and staying healthy and are aging well.
One of the things I got to say is it's so interesting because a lot of the calls that we get on the Helping Seniors information line start off with, I was down visiting mom or dad, and I get down there like 2 times a year, 3 times a year, and I'm really getting worried because I don't know if they can handle it anymore. And so that check-in is sort of like a wake-up call for them. They're like, wow, I just can't let this go on because it's really starting to get unsafe. The beautiful thing about what you're talking about with TeleCare is that it's a very frequent check-in. So you're able to monitor, and because the person that's making the call sort of gets to understand the pattern of what's usual and what's not unusual, they can be more responsive if something seems to be going out of range.
Right. And if we do feel that, of course, we're going to respond to the family, but we can also send someone out to the house.
Yes.
And do an eyes-on, check-in to make sure that everything is okay, and then adjust services from there as needed.
Yeah, and then you guys, so even throughout COVID, you've been able to safely do in-home visits and help with that part of it. Now you've got the TeleCare part of it, but then you've also introduced another cool technology. What is it called? It's where it's the personal...
it's called the electronic caregiver.
The electronic caregiver, which is another great way that you guys have implemented technology to keep seniors safe through this time.
Right. And I really like that in combination with the TeleCare program, because it is something for independent and active seniors. It's a wristband or a pendant that will keep people safe no matter where they are. If they're at home or if they do go out to Publix to go grocery shopping, it goes with them. It has a GPS locator, cellular service. It can remind them to take their medications. It can, if someone gets lost, it can help us find them. And it is a help I've fallen and I can't get up button. So God forbid somebody is at home. A lot of falls, the majority of them happen at home and they happen in the bathroom. And this is waterproof. So if they fall, they can get help immediately. Mm-hmm. So, those two programs between the electronic caregiver and the TeleCare program, I think, we can keep a lot of people safe, especially if they are still uncomfortable with having somebody in the house, or maybe they're just not quite ready to have someone in the house. I'm not quite ready to have help. I still want to stay independent, and I don't want to have, feel like we were just talking about that on break. A lot of people are you've been independent for so long, they're hesitant to have that help in the home. This kind of can bridge that gap.
Yeah,
And they probably won't admit it, but they probably look forward to your call, your TeleCare call.
Right.
They just say, wow, there's someone out there that actually, besides my family, that actually cares about me and making sure I'm okay. So they look forward to the call.
Right. And because it
helps
isn't
their
a family
mental-
member
helps
and
their
it's more of
mental
a
outlook,
peer,
too. Yeah.
yes, it really, it's a call from a quote unquote friend
Right.
versus, maybe the daughter. So we're, because of that, we get away with a little bit more.
And I was thinking about, you guys have so much expertise in this because you've been doing this now for many years here locally. So you know everything that's going on, the resources, but now you're able to really sit down, and when you sit down and meet with a family, you're really able to craft something that will fit to the nuances of whatever's going on there, I think. And to me, that just seems so valuable. I want to ask you to make a comment on that, but also please share the phone number. So if somebody says, all this stuff is sounding pretty interesting, I'd like to get sort of a more up-close lay of the land for it.
So please give us a call at 321-722-2999. Again, that's 321-722-2999. And you're right. We really do try to, when we go out and do an assessment, we want to make sure that we're meeting the needs of the person. We do a lot of listening. We ask a lot of questions and we do a lot of listening because we want to make sure that we are meeting the need. And that may be a combination of things. We are often, hey, all right, so we can do this part, but I want you to call Aging Matters because I think grab bars would be really helpful. We also want you to call, there could be other folks. My wheels have been turning talking to Dr. Kevin because we have a lot of clients who have COPD. And I'm thinking of a family friend in particular whose COPD is always exacerbated during the I was going to say flu season, during allergy season, spring and fall, and we've forbidden him, not that he listens, but we've forbidden him to go out and mow his own lawn anymore because he knows that is going to make it worse. But I'm thinking, boy, one of these units in the house would really help that spring and fall keep him out of the hospital and be able to keep him home and healthy.
Yes, by all means. When they tested this was not just for the COVID-19, but it has been tested, like I said earlier, for allergens. For for instance, it removes allergens and pollens. It says here 99.997% of the time. In other words, 100% of the time. Okay?
Yeah, let me just interject. We're talking about what we were talking about during the first half of the program,
Right.
which is this revolutionary new indoor purification system that has been proven to reduce COVID-19 in the air on surfaces by literally 99.98%, or for practical purposes, that means
Right.
all of it.
And you can live and work and play, and pets are fine around it, while the thing is working in the background at all times. And, so some of the health benefits, it helps you, breathe better air, of course. It helps you. A lot of people are saying that I never slept so well, since I purchased this thing. So it's really helping people sleep a lot better and a lot more sound. And it removes any of the type of odors that you may have in the house that maybe you might not smell, but maybe somebody visiting you might say, well, it's a little stuffy in here, or musty, or there's a little odor or something. But you just get living there, you get used to these smells, and you may not recognize them, but other people do. So this unit will also get rid of them. Believe it or not, there's less dusting and less cleaning, and most important is the less use of chemicals. And a lot of people are very sensitive to chemicals, especially cleaning chemicals. It virtually, I'm not going to say it eliminates the use of them, but it really lessens the major use of them, especially during this pandemic. And and just having a peace of mind that the air you breathe is clean, and the surfaces that you are touching are clean. And and it's not only for the home, but these units are go from small ones up to 2,000 square feet, and there's another one up to 3,000, and another one that goes up to 20,000 square feet. So not only for residential, but also for commercial use also. I mean, the list goes on. I mean, restaurants and hotels and doctor's offices and the health clinics and really any place that people gather. Any public place that people gather, these units would help the air that everybody in there is breathing. And surfaces they're touching.
Yeah, and as Jennifer was mentioning, though, if you have somebody that's fighting some kind of a COPD or something where getting good, clean oxygen air is important, having that pure, clean air that's not going to introduce allergens or basically take them out of the way, just seems like, once again, we're using technology to fight the pandemic, as it were.
Right, and these units, are going to be appearing on my website within the next couple of days. My computer guy is working on it. I can be reached at 321-549-0711, and the website's holistichealthcenter.us. And not only selling products, I'm still helping people with holistic cancer therapies, holistic addiction therapies, and natural pain management, as well as helping you really with any chronic condition.
This is so important as we're talking about this. You guys all remember the term high-tech, high-touch. They were talking about, as we go into an increasingly high-tech world, there has to be that personal component. And what I hear both of you guys talking about is that we're finding ways to use technology that does the best we can, is like the next best thing to being there. But at the same time, it's not replacing the fact that there is a lot of care and effort going into it. I know, Dr. Kevin Kilday, you sort of specialize in a number of holistic therapies. You actually are training other people. You have a college of natural health that you sit on the board of and participate in regularly. But you're actually sitting down, not only training people in this, but you've identified cancer protocols. You've got protocols for addiction recovery, and you spend a lot of time with pain management. So even though you might be having to have your call with somebody on a Zoom call, you're still very much able to communicate and try to help them find solutions.
Exactly. That's why I said, really for any chronic condition that someone is suffering from, as long as it's been medically diagnosed by a medical doctor, and they want to look into a alternative holistic type treatment, then I can help them with that.
So Jennifer, it's interesting because one of the things that makes you guys famous is the fact that your name is Seniors Helping Seniors. So we always get confused. We're the nonprofit. Well, you're the nonprofit because you sit on our board, as does John Harper. But for helping seniors, we are the nonprofit that operates the county senior information helpline. But you, as Seniors Helping Seniors, you actually hire seniors who go into seniors' homes and help provide the care on all these levels, whether it's in-home care or whether it's the TeleCare.
We do. We really do hire seniors. And I don't know if you saw on our Facebook page, our Seniors Helping Seniors convention was supposed to start October 15th. And unfortunately, we did not do that because of COVID. We stayed apart. But because Seniors Helping Seniors actually is a franchise, there's over 200 of us across the country. And they decided, let's do something positive. We can't get together, but let's really highlight what has happened and what's been done well through this whole pandemic. So we nominated a couple of our caregivers for an award, and we actually had 4 caregivers who won this recognition. Wow. So really, really pleased about that. One of them was Harry, who was here on the radio station.
Yes.
He's an amazing person. And then a few of our ladies also. We really do hire seniors to go out and help seniors. So it's been a little bit scary for them to go out during this pandemic. But in the case of the 3 ladies, they continued to go out and see a client who was in an assisted living facility. And, initially they said, we're not considered essential, but they did one night without her And they said, "Oh no, you are so essential. Please come back."
I am sure.
Because they keep her busy and out of trouble so that everybody, in the facility can do their jobs, and they don't have to kind of chase her down. So these ladies do an amazing job. They went out and were tested every 2 weeks to make sure that they were safe. They've allowed the daughter to talk to her mom on a daily basis. At a time when unfortunately there was no visitation, she knew her mom had really great one-on-one care while we were there. So having our seniors going out we're so thankful. We're so thankful for them and what a great job they do. And they do it because they love it, not because they have to. And it makes a huge difference.
Jennifer, are you finding now during the pandemic that now more than ever, people that are your clients, they need you now more than ever?
We really do.
To have that contact and interaction?
In the beginning, a lot of people did cancel services or restrict services, and I think we saw that backfire in many ways. And now, as unfortunately as this has gone on and on and on, we are seeing that more than ever. They do need us. They need us to come in and keep that socialization and companionship up.
I was going to say, it's interesting because when they told us 30 days to stop the spread, we were all thinking, well, we'll be back to normal.
We can do this.
We'll be back to normal by June. And then it crept on, and it was July, and now here we are. We're almost to the 1st of November. And it's still not clear. In fact, to be honest, it's become a lot of a political football, and it's hard to tell. It's now hard to tell hyperbole from what the facts are. But I wanted to ask you guys, since you're both in interesting positions where you're dealing with seniors on a daily basis and you're vitally concerned with their well-being, I just want to ask you, how do you think this plays out? Some people say, oh, it'll be all over as soon as they call the election. And then other people say, no, we're going to have to adjust into this for a little bit longer. So I just curious. It's just opinion, but I'd like to hear what you guys are thinking.
Well, I believe, that there will be a cure for it. I really do. With the way science is today, there has to be a cure on the on the horizon. If not, then I would think the next best thing would be a yearly vaccine, just like the flu, the flu vaccine, or pneumonia vaccine, or whichever one. But I think that's. I think this lifestyle that we're experiencing now, I believe it's just we're gonna have to put up with it for a while longer. Maybe into the first quarter, the first half of 2021, and I think we should be getting pretty much back to normal.
Interesting, Jennifer.
I certainly hope so. So I am in agreement. I do think that we will get a vaccine eventually, and we will be able to go back to some more sense of normalcy. But like you said earlier, I think we've learned a lot through the pandemic, and I think there are some things that will forever change. That some things for the better, some things for the worse, unfortunately. But one thing I am concerned about as this has drug on, like you said, first 30 days, we've got this, we can do this. 60 days, okay, no, we still have it. 9 months later, we're over it. We're all done. And people are wanting to force going back into, 100% normalcy. And we can't quite do that yet. We still have to hang on. And I think, and Dr. Kevin, you might have a more appropriate term, but I think compassion fatigue, maybe. We're so tired of doing all of this stuff, but we really do have to hang on a little bit longer. Exactly. And we have to keep ourselves up. We have to keep ourselves hopeful
and also
encouraged.
not get complacent.
Exactly.
Especially about maybe not wearing a mask, because you might be hanging around with a lot of people and working with them, and they're all not wearing masks because they're all COVID free, or they get tested,
or we think we're COVID free,
right? And they get tested regularly, or what? But that's not necessarily the true. Everybody should just continue practicing the maximum safety that.
And as a society, I think we as Americans or humans in general around the world we're being very selfish if we don't wear the mask.
Right.
Because we're not only are we protecting ourselves, but we're trying to protect our fellow person on the other side. And I think if we as Americans, we'll just keep this right here in America right now, if we did that very one simple basic thing of wearing a mask, we wouldn't be in the situation that we're facing today, where I believe the numbers have surpassed what they were at the height of the original outbreak.
Yeah, it's it's an interesting thing, because what I do seem to, at least anecdotally, understand is they've gotten a lot farther on. They understand what it is and what it does, and so because of that, the ability to treat it without horrific outcomes seems to be better than it was when this first kind of showed up. But the flip side is just what you guys are talking about. If we get complacent and we just say, "Oh, it's not a big deal," that's when it seems to kind of creep up.
And that's what I'm worried about. Is it's gone on for so long that we're kind of in a rough spot right now. It's difficult. We're over it. We want to move on. We want to go out and see people, but we still need to be a little bit careful. And at the same token, we still need to keep our social emotional health up. Right. So it's a tough. It's easy in the beginning. Okay, we can do this. We rallied, but that continuation, ongoing rallying is tough, and we need to make sure that we are still.
Yeah, and if you have children that are still in elementary or high school, they need to get back to their normal way of life.
Yeah, that's always we hate that term "new normal," but it is what it is. So we're about out of time on the show, but as we kind of wrap it up, I want to make sure everybody gets these phone numbers. So grab a pencil and a piece of paper, and let's start with Dr. Kevin Kilday, a Holistic Health Center. Give your phone numbers and your website, because there's really great information on your website.
Yes, my website is holistichealthcenter.us, and my phone number, which I personally answer all the time, otherwise my voicemail answers it, and I personally call you back all the time, and that's 321-549-0711.
Good. And for Jennifer Helin, to reach seniors helping seniors,
you can give us a call at 321-722-2999. You can see us on the web, seniorshelpingseniors.com/Brevard, and on Facebook.
Yes. And so with that sort of in mind, on behalf of Joe Steckler, our president and founder, Kim Bernard, who's our education specialist, we want to thank you for taking the time to join us for Helping Seniors Radio. You know, there are some great tools on the Helping Seniors website. There's some great TV shows, Jennifer, that you've done. There's some great TV shows, Dr. Kevin Kilday, that you've done. All great information, including that radio show that you did with Harry, your caregiver. That was a fantastic show.
He's an inspiration. If you're feeling down, go listen to that. And I want to be Harry when I grow up.
That was really an inspirational show, and they're all archived, so you can get them at helpingseniorsofbrevard.org. So, John Harper, that brings us pretty much to the close and the wrap of another Helping Seniors radio show.
All right, Kerry, sounds good, and we look forward to seeing everybody on the radio again next Wednesday, 12 noon to 1 o'clock, Helping Seniors of Brevard.